Hey, you guys, let's do a quick card chat and discuss the Somogyi effect versus the dawn phenomenon. Many of my review students get these mixed up, so I like to kind of talk about it and help you guys to have a little bit better clarity and hopefully retain it a bit easier, okay? So, patients present to us with hyperglycemia, right? And so they may come into the office stating that their blood sugar, their blood glucose has been elevated for the past week or so, or whatever the variance is. Or we may check at A1C or whatever and notice that it's been elevated. But we need to dig a little bit deeper. I know as nurses, we are used to treating the hyperglycemia. But as providers, when we are evaluating these people in practice, you have to be sure what type of issue this is and what is the cause of the hyperglycemia so that we can treat it efficiently. All right. So the hyperglycemia, you want to make sure that you're having someone assess it and bring back to you with nighttime readings as well as early morning readings. And I mean before 8 a.m. readings, okay? And so this is going to give us a better idea of what's going on. Because why? The dawn phenomenon and Somogyi effect both have early morning hyperglycemia, but the two causes is what the differentiating factor is, okay? So with the dawn phenomenon, I always say at the crack of dawn, because again, it's before 8 a.m., like 5, 6 in the morning, they're going to have hyperglycemia. That's it. You won't see any other variances. It will be the early morning hyperglycemia. So with the dawn phenomenon, you need to treat that early morning hyperglycemia, right? But with the Somogyi effect, I say Somogyi is the person's name who discovered this phenomenon or this effect. But I say it's a different name, right? It's not a common name. So something that's different or uncommon, it's the type of scenario as well. So what happens in this scenario is that they have hypoglycemia at night, which causes a rebound effect leading to that hyperglycemia in the morning. So I say remember that because that scenario is uncommon, just like the name Somogyi effect is uncommon. Okay? Dawn phenomenon only happens at the crack of dawn. So you only have those early morning hyperglycemia readings, right? So the early morning readings of hyperglycemia, so you can treat that. But the Somogyi effect, the cause of the hyperglycemia that is noted is the hypoglycemia at night. So that means we need to adjust and treat that and figure out what is causing the nighttime hypoglycemia. So if they are on insulin or something that is covering or coverage at night, we need to either stop it or decrease it because it's causing us to have this rebound effect leading to the morning hyperglycemia. So I say stop or decrease it because you may see either one on the exam, but it won't be both. So one or the other, you know that we need to adjust whatever is potentially causing this hypoglycemia at night and then reevaluate because you should see the improvement in the hyperglycemia in the morning. So, okay, repeat, recap, quick snippet. Crack of dawn, they only have the early morning hyperglycemia, only at the crack of dawn. So you should treat the morning hyperglycemia. Somogyi effect, the name Somogyi is uncommon. So the uncommon scenario of hypoglycemia at night causing hyperglycemia in the morning is what occurs. We're treating the hypoglycemia and correcting whatever the cause is of the hypoglycemia because that is what is causing the morning hyperglycemia. All right? So I hope you found this tip helpful. Save it, share it, bring a friend along. Be sure that y'all are following me on all platforms. The Nursing Studio on Instagram, on Facebook at The Nursing Studio, my business page. My group is the Nursing Studio MP Board Survival Group, where we work through things and do practice questions and get tips and tricks to get you ready for boards. And then, of course, on YouTube at The Nursing Studio. Make sure it always says The in the beginning and you see my logo, okay? All right. Bring a friend along and meet me back here next week.